Sickle cell diseases are a group of conditions where the major complication arises due to the defective hemoglobin S. It's a genetic inherited condition that in the carrier state, so when someone is a carrier, has very little effect on their day-to-day well-being. However, if the sickle gene is inherited in the homozygote state, so if two genes are inherited from each parent, then the person has a form of sickle cell disease that results in a number of problems. One of the problems we know is that the patient is likely to have a degree of anemia, what we call a hemolytic anemia, where the red blood cells are broken down. And one manifestation of this is increased jaundice, so that's because the bilirubin is raised, and the urine can also be dark, and the degree of anemia can vary from one person to another. The other complication we see is an increased risk of infection, and that's mainly because the spleen, which is an organ involved in protecting against infection, so part of the immune system, doesn't work quite so well. And particularly in young children, we know that there is a significant mortality associated with infection, and that's one of the reasons why the penicillin prophylaxis was recommended, and also the immunisation program to protect against invasive pneumococcal disease, because we know that this particular bug, pneumococcus, is likely to result in severe sepsis, for example meningitis or pneumonia, that can be life-threatening, and we know that these two interventions can help to prevent it. So those are two complications. The commonest complication, of course, is the painful crisis. And this can affect any part of the body and is a complicated process. We know that sickle cell can affect both the small blood vessels and the large blood vessels supplying any organ in the body, even the skin, muscle, bone. And the impaired blood flow that can arise because of the sickling process when the oxygen level falls can result in impaired oxygen delivery to any organ or any tissue, and that results in pain as a result of the build-up of toxic products. And that's often self-limiting, that improves over time, and some of the measures we can take, like hydration, avoiding extremes of temperature, avoiding overexertion, avoiding any stressful event, can help to minimise the risk of this more common complication. The difficulty, of course, is predicting which or any of these complications are likely to be manifested by any patient, because from one person to another there is so much variability, and it's difficult to predict early on in the course when children are first diagnosed. It's difficult to explain to the parents whether one child is likely to have severe problems or less likely to have any of these complications. And that's why it's important that people are seen regularly, they're monitored for complications, the growth and development for children is monitored carefully, and we take precautions to prevent as many of the complications as we can. If we recognise these complications, then we can ensure that they're promptly treated before a severe problem arises. There are lots of ways in which sickle cell can be treated. So some of the simple ways, for example, having some awareness, so education of the community, the patient, schools, hospitals, is a major part in the overall treatment strategy. For more specific treatments, for example, we talked about the risk of infection, so it's important to think about ensuring that people are appropriately vaccinated, particularly to protect against invasive pneumococcal disease. And for that, we currently recommend the Prevnar vaccine, which is now universal to all children in the UK. But in addition, we also give the Pneumovax vaccine to give additional protection. Penicillin prophylaxis is recommended for all children, and for adults, although the data is less prominent, it is likely to benefit some people, and we therefore recommend, if you're not developing any side effects or intolerances, it's sensible to continue. And then there are other precautions, like ensuring people are well hydrated, that they avoid extreme dehydration, they avoid very hot conditions, very cold conditions, very damp conditions, and these factors can help to minimise some of the painful events. We also educate parents to be aware of complications like splenic sequestration, so the parents feel the tummy of the child regularly, and if they pick up an abnormality such as the spleen size is increasing, then early presentation and early treatment can help to save lives. Of the more major complications, for example the acute chest complications or stroke, then the immediate treatment involves transfusion therapy, depending on the severity and presentation of the individual. And then we have treatments for chronic complications. For example, if somebody has lots of pain, we may consider treatment called hydroxyurea or hydroxycarbamide, which is a medicine that has an effect on increasing the fetal hemoglobin and therefore modifying the amount of total hemoglobin and the whole sickling process. So that's a first-line therapy for people who have frequent, regular pain and particularly require admission to hospital often as a result. Transfusion therapy is first-line therapy for children who, for example, have developed a stroke. Then they go on a transfusion program. The transfusion programs can also be used sometimes for pain, sometimes for acute chest complications, and likewise hydroxyurea can also be used for acute chest complications. So those are the two sickle modifying interventions that we have available to us. There are other treatments, for example bone marrow transplantation, which is the only curative intervention, and in the future perhaps gene therapy or other novel therapies might be available. I think it's important that the environment in which sickle patients are treated is of a standard whereby both the nursing and the medical support is to a standard whereby people are well trained, well aware of the complications, and that the environment is suited to managing sickle-related complications. So a dedicated ward can help with that, because you can ensure that the personnel are well trained and the patient will therefore receive prompt treatment. Their complications and their needs will be well identified, and it will also provide an opportunity for other aspects of their care to be centred. For example, if they have any social needs, if they have any psychological needs. Within a ward, you can ensure that that was tailored for or catered for as a one-stop shop.